is John Gabel. And John is a nationally recognized expert on the employer health benefits sector. He's a senior fellow with the National Opinion Research Center of the University of Chicago, located in Washington, D.C. He's been working on employer health benefits, I believe, since 1986, and has published more than 135 articles in scholarly journals, including 57 in the influential journal Health Affairs. He's on the editorial board of a number of journals, and he's been on many major television networks. And so please join me in welcoming John Gabel.
Thank you, Paul. Well, let me begin by thanking Margaret and Paul for bringing together what is my and yours best conference we will attend this year. The conference is unique in that not only are the speakers the same each year, but the audience is the same each year, and they sit in the same seats each year. But it's also unique in the diversity of the people attending the conference, that we have practitioners, we have business people, we have state officials, we have federal officials, we have policy wonks, and we even have economists. Now, as you know, I am a compulsive public opinion pollster. So let me poll you on a couple of things. First of all, last year I asked you, facing a Supreme Court decision, a presidential election, I asked you, would the ACA be overturned? And you voted overwhelmingly no, it would not. And you were correct. So my first question for you is on healthcare. Are healthcare costs heating up or cooling down? So those who say they're heating up, show of hands, please. And those that say it's cooling down, okay, we'll find out a little bit later on. You'll get the answer. Okay, now, my second question. 2013 is the calm before the storm. 2014 begins the ACA. Do you think the launching of the ACA will be characterized as smooth or chaotic? Do we have any votes for smooth? Okay. Now, here's my third question. How many people here have gone on cruises? Show of hands. Okay. Now, I bring this up because as I was going through the line this morning, all of a sudden I had a flashback. I thought I was on a celebrity cruise. But no, it was not. And I tell you, I have been on 15 cruises. My wife and I have been on 15 cruises so far around the world. And if there's one thing I've learned on the cruise, is speaking to the citizens of other nations and other democracies, is the people from the democracies intensely believe in democracy. And they were willing to fight for democracy. And at the same time, the democratically elected officials from those democracies, they detest. A little bit of a paradox. I've also learned, talking to these fellow cruisers, that in every country of the world there is a concern about rising healthcare costs. But almost without exception, people are opposed to those measures that might control healthcare costs. So that is the paradox paradoxes that we face. Now let's see if I can master this technology. So here are the objectives of this presentation. First of all, I want to document the state of employer-based health insurance. I want to examine changes in these benefits over the last year and the last 5 and 10 years. I want to look at premium increases in the individual market. And lastly, I want to review how the Affordability Care Act is likely to change coverage. So this is based on the Kaiser Family Foundation survey and the California Healthcare Foundation survey, and we have people here from the California Healthcare Foundation, and I thank you for your funding. Last year, the Kaiser Family Foundation survey had 2,121 randomly selected employers with 3 or more workers, public and private, in the sample. We began in January interviewing employers, and we ended in May. The response rate was 47%, and as I emphasize each year, it's getting more and more difficult to survey employers. The survey goes all the way back to 1986 at Health Insurance Association of America, the trade association which no longer exists. It's now part of AHIP. And it was all, then it goes back historically to KPMG Pete Marwick during the 90s. And then in 1999, the Kaiser Family Foundation funded the survey and runs the survey today. I use statistical weights. Most of the figures I give you will be employee-based weights. The majority of people who have employer-based health insurance work for firms with 1,000 or more workers. And sometimes I'll use employer-based statistics, but when you use employer-based statistics, they're dominated by small firms, so I'll break out large and small. And now the California Healthcare Foundation survey of employers. This survey does not interview public employers, only private employers, 3 or more workers. The questions are essentially very similar, most of them are the same between California and Kaiser. The employers are chosen randomly. The sample size was 770 last year. I got permission to present these results, which have not been released yet. We're actually going to be released in about 1 week. So I thank again the foundation for allowing me to reduce the results. This California survey was first funded in 1999 from Kaiser, and the California Healthcare Foundation has funded it since 2004. So let's look at results. Here is our history of employer-based health insurance going all the way back to 1988. We can see the different eras of private health insurance, of employer-based health insurance. This period right here I would call the era of restrictive managed care. This is the retreat from restrictive managed care. And now here's the movement to high deductible plans. Okay, last year, premiums increased 4%, down from what we reported 9% the year before. I believe that 9% figure was an anomaly, an aberration. I believe somehow or other we got a bad sample. Nobody else, the other surveys didn't show this same hike. And so we're really down to the same level we've been at with a couple of years of 5% increase. Okay, big caveat. These figures do not control for changes in the richness of the plans. It's absolute figures. It doesn't control for changes in the covered population. Now, last year, though, the 4% was about 2% higher than the increase in overall consumer prices and about 2% more than the increase in workers' wages. So we have, again, looking at these historic lines, you can see the great volatility of health insurance premiums. You can see how almost without exception every year, premium increases will outpace advances in workers' wages and overall consumer prices. All right, how much does health insurance cost? We are now to the point, if we go down to the very bottom, where in 2012, it was over $5,600 for single coverage and almost $16,000 a year for family coverage. Now, if you are a minimum wage worker and you work $2,000 a year, you will earn less than the cost of family coverage, total. You can also see from these bars, you can see that the PPO plans tend to be the most expensive, and that the high deductible health plans tend to be the least expensive. Those figures on the high deductible health plans do not include the contribution of the employer to the savings accounts. Now, another caveat. Again, there's no controls here for geography. HMOs tend to be strong in urban areas where they face higher expenses. There's no control for the sickness of the population, the risk of the population. And there's no adjustments for geographic areas. So, and there's no control for the richness of benefits. And we know from other work we have done that HMOs will have a actuarial value of over 0.85 on average, close to 0.9 in California. And the high deductible health plans will have much lower actuarial values, more like about 0.75 or so nationally. So big difference there in the richness of benefits of the different plans. Now, how much are workers paying out of pocket for their premiums? As we know, in 2013, for the first time on our W-2 forms, we now see the employer contribution for health insurance. And there have been a number of articles in the media which have talked about sticker shock, people being surprised at how much the employers actually contributed to their health insurance. And of course, most economists will say, well, ultimately, that contribution by the employer really came from the employee through lower wages. Just about nobody else in the world believes that. In the short run, I guess, and if I can do a synthesis, in the short run, it is not true. But there's a long-run adjustment, I would assume. And then, of course, as Keynes said, we're all dead in the long run. So you can see last year we showed the average is $79 per month for contribution for single coverage and $360 for family coverage. It indicates that employees are paying about 18% of the cost for single coverage and about 28% for family coverage. I think it's noteworthy, if we look over at on the family side, it's been relatively constant over these many years. And on the relatively constant on the single coverage side over the last couple of years have been slightly higher than previously. What kinds of plans are Americans enrolled in today? The big change is the high deductible health plan, where 19% are now enrolled, up from about 4% in 2006. HMO enrollment is declining. It's now 16%. It hit its peak in 1996 at about 31%. And the point of service plans are also on decline, having peaked at about 23% in 2000 or so, and now at 9%. And the PPO coverage is now at 56%. But of course, most of the high deductible health plans with savings options are really PPO plans. So if you look at it, back in 1996, we were in an HMO world where the majority of people were in either an HMO plan or point of service plan. Now today, the PPO type plan is dominating. Indemnity insurance is less than 1% now, was 73% back in 1988. Now, this graphic shows all plans. Those with deductibles and without deductibles have all been averaged together. And you can see that since 2005, the average deductible has tripled. Has tripled. More plans have deductibles, and those average deductibles are increasing. So we're now at over $800 for the average deductible. We know from our economic research that higher deductibles mean people will use fewer services. We know that they will result in a reduction in spending. It seems like its big effect, though, is not on the hospital side, but it's on the ambulatory side. And also, although it is still disputed, it's still very difficult to make the case that higher deductibles make people better consumers. It seems like cost sharing tends to be a blunt instrument where both the good and the bad are cut. By the way, if talking about deductibles, if we went to small employers, among small employers, 50% or more of the employees have a deductible of 1%, $1,000 or more nationally. Okay, now we're going to California. And you can see last year the increase was 6.4% in California. We have a different way of measuring premium increases in California than we do nationally. I think actually the way we do it in California is a better way. And you compare that to the overall increase of 1.7%. So actually, California seems to have been experienced ever since 2000 or so, higher rates of increase. Back then, I used to talk about the California miracle, how healthcare in California costs less than it did in the rest of the nation when your real estate prices were so very high. As the next graphic will show, there's no California miracle anymore. In fact, if you look at single coverage, it looks like it costs 17% more in California. And if you look at family coverage, it costs about 6% more in California. And for every type of plan now, it says California is more expensive than nationwide. All right, now let me, though, here's our caveat. We go to F. Scott, if I can paraphrase F. Scott Fitzgerald, California is different. And then the next one will show you why. But your plans in California have much more financial protection than what they do in the rest of the country. So much of this trend is simply that you have maintained largely the actuarial values of the plans, or maintained them to a much greater extent than the rest of the country. And I think the next graphic will show why. So looking at California, 55% of the population is enrolled in an HMO plan, and another 7% in point of service plan. And your high deductible health plans only enroll 5% of your employee population, as opposed to 19% among nationally. So different kinds of plans in California than in the rest of the nation. The PPO market share is 33% in California compared to 56% nationally. And so your plans have greater actuarial value than in the remainder of the nation. Californians face much less cost sharing than in the remainder of the nation. And here's an example, whereas 50% nationwide of the small employees face a deductible of $1,000 or greater, it's only 26% in California. And you may also note how among large employers, only about 8% face a deductible of $1,000 or more dollars. And overall, it's 14%. All right, now I want to present, again, this is the first time this has been presented. This is a study that NORC, and I was the lead on it, did for Department of Human DHHS. This was a difficult study, but let's go with a little background. The ACA, beginning in 2011, has rate review and has medical loss ratio review. And medical loss ratio, just for probably everybody knows, but I'll say it again, it is the ratio of medical benefits plus quality improvements divided by total premium. So, in other words, it tries to say, here's your benefits, and the other part that's not in there is your administrative expenses plus profits that are going to insurers. So the medical loss ratio is supposed to be, beginning in 2011, oh my gosh, okay, small group. Give me 2 minutes more than that, I think. It's supposed to be 0.8. And in addition, there was review of all premiums with 1,000 or with 10% or more. But the important point was, if your loss ratio, you didn't meet your 0.8 loss ratio, then you had to give money back to the subscribers. So this is what we did. We extracted data from the carrier filings in 28 states. That's about 28 from 2008 to 2011, 2,800 individual insurance filings, 1923 small group filings, and we extracted the data from public websites, on-site data collection, state insurance department contacts. Dirty data, not homogeneous data, very difficult. Sometimes documents actually contradict within themselves. And we try to extract the premium increases from the plans, and the plans are weighted by employment. So here's the result. This is the first year that the rate review went into effect. And you can see that there was a decline in the individual market from 11.7 to 8.6, and in the small group from 8.8 to 6.7. Now, can I say that this decline was due to the ACA? Well, of course, as far as scientific standards, I would say it is only suggestive. And I got a quote here from Rudy Dornbush, who is an economist, deceased now, but he has this quote: "Disorder is for the social sciences the sole substitute for controlled experiments of the natural sciences." And unfortunately, we didn't have disorder in 2011 because all states were subject to this. We had no control group. So it makes it very difficult to attribute it by scientific standards to the ACA, but I would certainly say it's suggestive. And now here is Jim. I got to get Jim on this one. This is the new estimates by the Congressional Budget Office on the changes in enrollment as a result of the ACA, and you can see the decline of 27 million or 14 million in the first year of the uninsured, and that employer he eventually is going to decline. Now, why did the CBO, and Jim, you can correct me on this, why did they say that? Well, it's because of the tax changes that went forward in 2000, right? Taxes, this is CBO thinking, right? The base changed because the old base was Clinton, right? The new one has lower rates. It has lower rates as a result of the fiscal cliff negotiation. Because the rates are lower, the subsidy is less. Because the subsidy is less, fewer employers will offer coverage. So, you know, just think, the president could have gone up in a State of the Union message and said, I'm raising your taxes because if you raise taxes, more employers will offer coverage. The number of people on Medicaid will decline, right? You know, we'll do a lot to control it. So you can correct me when I'm wrong, okay, afterwards. And now lastly, just let me summarize. Premium increases by 4% nationally, 6% in California. Deductibles have increased substantially to $800. High deductible health plans growing nationally, not taking off in California. Some evidence that rate review has lowered premium increases in the individual and small group market, and future growth and coverage is likely to be in exchanges. Now, does everybody here, public opinion, does everybody here remember what Joe Biden said to Barack Obama when they signed the bill in 2013? Okay. Okay, so here are some other big deals. The chaos in 2006, if you can remember the first couple of months. Medicare and Medicaid was surprisingly smooth. And the Civil Rights Act of 1964 was surprisingly smooth also. So that's what we have to look ahead to, and I thank you.